Hello and welcome back to Sinar Daily's Sports Matters podcast. My name is Ashwin and I'm your host for today's discussion. The Euro is over and it's about time to dissect something important, and the issue is the recent sudden cardiac arrests involving athletes and sportsmen, which has rocked the sports industry. So to dissect this matter, we have two fantastic panelists here with us. And firstly, I would like to introduce our first panelist, Dr. Aisha from Taylor's University, a senior lecturer in emergency medicine at the School of Medicine, Faculty of Health and Medical Sciences. And we also have sports journalist, Wan Ahmad Atta Remizi. He's also an athlete and a sportsman as well, so he will be sharing his point of view regarding this matter. Guys, welcome.
Thank you for having us.
This sudden cardiac arrest, I don't know, it's because of social media, or those days not because of social media, I'm not sure, but now it's a lot of it, cases involving it. Is it because of social media or before this memang tak ada?
Well, okay. So to understand what's going on, okay. So let's clear the terms of what it means by sudden cardiac arrest. So when we talk about sudden cardiac arrest, it means that the heart suddenly stops beating, or it starts to beat very irregularly and fast, very chaotic. We call this ventricular fibrillation. So either way, when it happens, what happens is that there's not enough blood that is circulating around the body to provide oxygen and nutrients. Okay? So not necessarily sudden cardiac arrest is a heart attack, but the heart attack is something that causes, can be one of the cause of a cardiac arrest. Okay. So when we look about cardiac arrest in general, actually it's very common. Okay. So for us, the general public, maybe about 1,000 cases per day worldwide. Okay, so it's a lot. So all emergency department will receive at least someone who has had a cardiac arrest in public. But when we focus on athletes, it's not a very common phenomenon. So we say about, in the general public, it's about 1,000 people per day. But in the athletes, it's about 1 to 3 athletes per 100,000 population. So it's not a very common occurrence. However, correctly like you said, with the social media, it's becoming more obvious, okay, especially in certain sports that people like to watch. So for instance, in our Asian community, we like to watch badminton. Okay, so that became very apparent. Our community also likes to watch football, right? Not me in general, but football. So in 2003, I think, in FIFA, there was one footballer who went into cardiac arrest during a match. And unfortunately, he did not recover from it. I can't remember his name. I think Mark Vivian Foy or something. So he had a witness cardiac arrest. So that one, it starts to ring bells when you start seeing it. So there was another occurrence who was a player for Bolton. More recently, he also developed cardiac arrest, but he survived after 60 minutes, around 70 minutes of resuscitation on field and at the hospital.
There's one famous club, also Newcastle United, I think. PCC.
So and also those are the ones that we see, but in other countries where their sports is more prominent, like say in America, where they play a lot of American football, then we might hear actually there's more of that occurring.
Understood.
And among basketballers as well, they have a specific risk factors because it's sudden cardiac arrest in athletes is more common in male, in Africans,
Doctor,
yes.
I would like to pause you there because there's this, netizens, they are famous for theories.
Yes.
You just mentioned African.
Yeah.
There's this crazy myth, they'll be saying that, Africans eating a lot of meat and all that. We also eat a lot of meat.
Yeah.
Oh, but that kind of theory, Doctor?
It's more due to the genetic predisposition, I would say. Okay. So for instance, another famous person you might know if you watch basketball is the son of James LeBron, who last year during practice developed sudden cardiac arrest. Okay. And for him, the cause was some sort of congenital malformation inside the heart. Okay. So when we talk about sudden cardiac arrest among athletes, especially in young athletes, actually they have some sort of problems with the heart, either the structure of the heart or electrical conduction of the heart. Whilst in older athletes, so also if we read about occurrence in footballers, I think there was one local footballer as well who was slightly older, maybe after 30s. So the risk of heart attacks is more common among them. Okay, so there's the two groups, so the young athletes and also the young athletes and the older athletes is more common in males, but we're now more hearing about it because of the social media, definitely. Yeah.
Thank you, Doctor. I remember just 1.5 months ago, you wrote a project piece about this sudden cardiac arrest. But of course, it encompasses of smoking, vaping, and everything. In the sports industry itself, as a sportsman, if you ask me, like yesterday I met a buddy. He told me that he was informed by another friend who was active in sports or something like that, and he passed away because of cardiac arrest. And the advice given by the other friend to him was, you're fit, you're playing futsal, you're hiking, you're jogging, you're too fit, be careful. Now it has come to a situation where it is dangerous to be too fit as well. So how's the situation like? What triggered you to write those stories?
Yeah, well, first of all, like you mentioned, it was a piece. So initially I wrote about those articles about sudden death among young individuals and also athletes. And on not long after that, we heard about the news of China's badminton player, Zhang Ji. Hopefully I pronounced his name correctly. And I think people ponder a lot on this issue, because how can someone who's young and someone who's physically active, suffer cardiac arrest and subsequently, die. So, and I think a lot of people wonder how can these things happen, and maybe some people now might, think incorrectly that being fit is dangerous now. Maybe there's something that maybe it could be. Maybe there's something that we could enlighten these people, because I think me personally as well, I have certain questions that I would like to ask moving on. But it's a bit peculiar, because if you see, let's say, someone, normal people like us, if let's say those things happen to us, maybe no one would bat an eye. But because these people are young and they're active, physically active, so people are like wondering how can these things happen.
Doctor, you want to add on something? Go ahead.
So it definitely would shock a lot of people, because our presumption, if someone who is young and fit, they are the epitome of health. Nothing's going to happen.
Because everyone would like to be like them.
Yeah, everyone would like to be like them. But the problem is, because they are this highlighted group, there is a certain certain conditions that are more prominent in them, which might go undiagnosed. So not necessarily saying that if you decide that exercise is bad for you, exercise is actually good for you. It does for the general population. If we don't just look at athletes, then it is good for you, because it reduces the risk of you developing a heart attack, reduces the risk of you developing a stroke, and it increases your longevity. Okay, so but it's on the other hand, if you are someone who's not done exercise before and decide to, this is the time I'm turning 40, this is the time I want to become fit. And then you suddenly go all out, then these people are more at risk of developing sudden cardiac arrest. Okay, so my advice is, if you want to start, is you start back slow. Okay, get yourself assessed first before starting. Okay, but it shouldn't be a hindrance of doing exercise, knowing that there is this risk of sudden cardiac arrest. Okay, because as I said, in athletes, the risk is fairly uncommon, but because we watch them on TV, they are considered like a
the model.
They're model. They're a model. So so because we watch them and we see it on live TV, it happening, it's very tragic. So having said that, Prof,
you mentioned just now 40 years old suddenly want to embark on an exercise program. This is actually a very good point. You know why? We are living in a world where everything you need to Google, steps, what I need to do, everything you need to go through assessment. Okay, is it better for someone, let's say I'm 40 years old now, I've lost 10 years of fitness life, okay, time to get into fitness strategy. Is it better for me to get a trainer, coach, so that I can go through one at a time?
Okay, so this is a personal opinion. I feel you should get yourself assessed health-wise first before embarking on the journey.
Okay.
Like it's always good before starting to see what is your baseline health level.
My condition.
Okay,
like.
yeah. So because when you're young, you don't think about this. Even if someone might have high blood pressure, but because it doesn't manifest, then they don't worry about it.
Correct.
Even if they have diabetes, if there's no manifestation, then they don't worry about it. So the first advice would be get yourself through a general health screening first. So it can be just as simple as going to the clinic and assessing your blood pressure, checking your sugars, okay, doing a baseline blood test, okay, to see whether you're more at risk, for instance, if you have high cholesterol or anything like that. And once you get that, at least you will be reassured to a certain extent that you can start. And when you start, don't immediately decide, okay, I'm going to run a marathon, so today I'm going to run for 1 hour. No, you can, yeah. Then for those, so you choose what you want to do. And if you would like to find a trainer, that will be even more better, okay? But the information out there is abundant, but the general advice is to start slow. Don't go jumping head into something.
That's a good advice, Doctor. Doctor, what do you think the symptoms, basic symptoms that sportsman or athlete should take note?
Okay.
If it's bound to go to this way.
Okay.
Yeah.
So when they did the study, they saw that actually a large majority of young athletes who went into sudden cardiac arrest, the cause is unknown. Okay, but when they dissect that further, they feel that even though it's unknown, there is still a proportion who have some inherited cardiac condition that might not be visible even during screening, meaning if they did an exercise test, they did the heart test and everything, it might not be seen. So unfortunately for some of these patients, they have the clean bill of health. Okay. And the only presentation is that sudden cardiac arrest. So that's one group of people.
Okay.
So but those who are at risk of conditions that we know of, okay, they might have symptoms of when their heart starts to beat irregularly. So one of the things that the American Heart Association suggests to ask as part of the screening questions are those kind of symptoms. Meaning like even if they were fit and healthy before, say prior to attending a sport event, then they get this health assessment. Then they will ask whether if the sportsmen have had any decline in their physical activity. So meaning before they were well, but suddenly normally they run for 1 hour, there's no problem. But this time they run for half an hour, they start to feel lightheaded. So lightheadedness, dizziness, any fainting episodes during the sporting event, okay? If the heart starts to beat very fast, so they feel palpitations in their chest, okay? They start sweating profusely for no known reason, okay? Or they start feeling short of breath. So basically anything that normally is out with their normal. So because they're very fit, so they can run long distance, they can do a lot, but suddenly they start to notice, oh, actually I can't do as well as I did before. So that is one of the red flags. Okay, for older athletes, then the main cause of sudden cardiac arrest is a heart attack. So we need to look for signs of those. So general advice for the public as well. So there is this condition where we call angina. So angina is a chest pain that occurs when there is an imbalance between blood supply and the demand. So meaning when they are doing physical activity, so they are exercising, and then so there's increased demand for this oxygen.
Yep.
But that's not enough because there's a problem with the blood vessels supplying the heart. So they will start feeling this chest discomfort, okay? They start sweating, they have these aches going down their arm, or they start feeling lightheaded. But once they stop, and take a rest, this pain goes away. So that's another warning sign that they might proceed to develop a full-blown heart attack. So if you start having those symptoms, or you've had it and you're not sure because it only lasts for a few seconds or a few minutes and you ignore it, but you notice it becoming more frequent. So meaning like maybe since you started going for walks, you start experiencing this pain after you've walked for 30 minutes, but once you rest, it's fine. So you leave it. But then the next time you go for a walk, you notice that it becomes like every 15 minutes that you have to stop. So that's a telltale sign something is happening, or the pain becomes more worse, or the pain is there and it won't go away. So that's another telltale sign that you should immediately seek medical help. Yeah.
Okay, doctor. You know what? As you start explaining this, I'm already getting scared because I play futsal.
Okay.
Once a week. My God, whatever doctor just said, it's scaring me because
It's deja vu, is it?
I do go through that. When I just played 7 minutes and I'm profusely sweating and thank God futsal is like you take gap, so you recover.
Yeah.
But whatever you said, is there, and some of my friends experience a lot.
So
like
it's
whenever
a sign
we
to
play,
get assessed,
when we are defending, there'll be another player, and I can hear him, palpitating. So sometimes I'll be thinking, am I same like him or what? Yeah. But you are right.
Yeah.
Get yourself checked.
Yeah.
You know, one, you put my bola, futsal, and everything. How about your peers? What do they say? I mean, like whatever doctors say. Is this true?
For now, because I'm much younger than you, so I've belum encounter lagi lah those kind of stuff. But at the same time, because even before I wrote this piece and even before the Zhang Ji's case, I've read about articles mentioning about sports during the night, and I've also talked to medical experts, etc. And there were various opinions on whether one should do sports during the night. And funny enough was like I think last week I was back from holiday, so I was quite exhausted from a 4 days trip, and then the next day I had futsal, and also during the Zhang Ji's case, that night I had futsal as well. So I played like with very cautious because I don't want to be end up dead on in the field or etc. So it does have somewhat like an effect on me, playing just to the let's say like minimum level lah, not overly exert myself. So
okay, overly exert. That's the next question, doctor. What role does stress or over pushing yourself plays in sudden cardiac arrest?
Right. Okay. So it's just natural behavior of athletes.
Yeah, the game.
They want to win.
The passion.
They want to push themselves. They want to achieve something out of it. So they put this pressure on themselves. And especially when nearing events, they will start to train, and some might train out with the recommended duration, the recommended intensity, because they are trying to push to reach this goal of winning and accomplishing something. So but in the general population, so in most athletes, I would say, it doesn't pose that much of a risk, unless these athletes fall under the category that even though if you screen but there's nothing, they actually have some abnormalities that you cannot see in them. So the risks are increased in them. So why do I say that? Like for instance, when you go when you overtrain yourself in the heat, so heat exhaustion is another thing. If it's the weather, the environment is so hot, you can get heat stroke. So when the heat is so high, when you're dry, you're dehydrated, you forget to drink, you're overexerting yourself. So this condition, the heat, the dehydration, it can cause an imbalance in your electrolytes, in the salts inside your body.
Yep.
Now, what controls your heart conduction is actually all the different salts. They have different channels here and there, and they are the one that controls and allow and say, oh, this electric is going to go past through these cells. So when you have abnormality in the salts, the electrolytes, then it can cause abnormality in your heartbeat. Okay, so you're actually the risk is actually more increased in those in that group who has either a congenital or an inherited condition, whether it's known or whether it's unknown. Yeah, so the risk is increased in them.
Understood.
And then when we talk about the older athletes, but by the way, when I say older, it's 35. It's we're not talking about 65.
In sports, that is old.
So we're talking about above 35.
Yeah.
So again, there are risks of developing a heart attack. And heart attack is normally due to abnormal in the blood vessel where it's already become narrowed. So when you overstress yourself, your blood pressure shoots up. It can it can injure the surface of this abnormal blood vessel, and then your blood goes crazy and forms a clot there, and then you develop a heart attack. Yeah. So with stress, when you have this over adrenaline rush, it can increase the risk in the certain groups. Yeah.
All right, doctor. I remember you just mentioned when you don't drink enough water according to the stipulated guideline or whatever. Nak tanya one ni, soalan very local lah ni. Okay, Malaysian athletes. I'm not talking about the one in Olympics and Commonwealth or whatever. But I'm talking about main futsal biasa dekat futsal court. We have this culture of bila you nak kena minum air, you go for vape. You go for a cigarette smoking habit.
Yeah.
You are a sportsman. You're also playing futsal. I'm pretty sure you saw this culture is developing among youth. When you talk to your health experts before this, while you're filing stories, was this one of the concern as well?
Yeah, obviously, besides vaping and smoking, whatever the bad effects it will lead to the heart and subsequently to cardiac arrest, etc.
Is this culture?
Yeah, I could say from my own experience as well, because most people who goes to futsal or plays football, plays badminton as well, lots of them are smokers or vapers, and sometimes the futsal and football fields, they are an open space, so even when there are signs like prohibited from smoking or vaping, but because it's literally an outside space, so people assume that okay lah, I can smoke here, I can vape here. Maybe in badminton courts it's quite different, but I've seen as well people
they'll just go for a quick
yes, because between vape and cigarette vape, it doesn't have any bad smell, doesn't have any bad odor, so people maybe might not be disturbed too much by vapes compared to cigarettes. So yeah, I think maybe it's personal preference. Everyone can buy whatever they want, but maybe there should be something that encourage these people, these people who exercise, do sports. In the meantime that you're doing good, you're exercising, maybe just for this 1 or 2 hours, let's not.
Don't do that. Don't do that.
Yeah.
So talking a little bit about nicotine, right?
Yep.
So vape contains nicotine, whilst your cigarette contains nicotine and other unhealthy chemicals as well. So I've had a patient before who come in who took vape, a young patient who took vape, and he just changed a different type of liquid. So he not knowing the amount of nicotine that is inside that particular vape.
Okay.
So he came in with palpitations. So his heart was racing because actually nicotine is a stimulant. So that's why a lot of people, maybe that's why some choose to take a smoke or when they're playing after sports, because it does give you that surge of energy, makes you more alert and whatnot. Not realizing actually the dangers of nicotine if it's in excess. Yeah. So in my opinion, both are not good.
I think it should be universal. You're in sports area, stop this. Don't even bother of trying that. Yeah, doctor, just now we mentioned about passion. How can athletes find a balance between, their passion of pushing it too much and taking care of their health. Yeah. Your own advice.
So it is a difficult balancing act, right? Because especially young athletes, especially when they are discovered, of course they can see their career path going to develop in that route. But it is important. The first step is actually the awareness of this problem can happen, that sudden cardiac arrest can happen. And if this awareness is ingrained into them, into their parents, into their surrounding relatives and families, so this will probably encourage them that even though that you are good at this, let's get yourself assessed first. Okay, so if there's no risk, then by all means go ahead. But again, bear in mind that this still might happen because there's a group of people that we don't know have any problem, even if they've been given a clean bill of health, and they can still develop sudden cardiac arrest. So I think the first step is the awareness, okay? And also, so even in places where the screening programs are in place, the concern is that because it's a series of questions that they ask, like, do you have this symptom? They might underplay that they say, like, I don't have, or personally they'll just ignore it. I was like, I do feel a bit dizzy, but maybe it's because I didn't sleep well. So they tend to downplay their own symptoms, right? So, but with this awareness, I think awareness that this can happen, then that should push them to to become more to take the screening seriously, and to get themselves assessed. So to follow whatever regime that's been given to them by their coach or their training team and whatnot.
Understood, Doctor. We both of you have mentioned about badminton, and he has also mentioned about the recent case involving Zhang. I have to ask this, Doctor. CPR.
Okay.
It was a topic of discussion in social media. I think you have addressed about it in your letter. Doctor, do you think how important is the training for sports events?
Okay. So CPR for me is very, very, very important. It's my bread and butter in emergency department. So what essentially is CPR? So CPR, what we're doing is basically we're doing chest compression. We're trying to mimic the action of the heart. So by pumping the heart, by mimicking that action, we are providing the vital organs, the brain, the heart itself, with whatever oxygen that remains inside the blood. So basically we're trying to buy time. Or sometimes it's even doing that act is enough to restart the heart. But if it's not, then it buys time for if it's due to some sort of abnormal rhythm. So it buys time for that treatment to be given, okay? And the risk of survival reduces with time. So meaning that the longer you delay the starting of the CPR, the cardiopulmonary resuscitation, then the less chance of this person surviving. Okay, so in my opinion, even at school level, if we can enforce it even in the PJK, Pendidikan Jasmani and Kesihatan, it will be even more better. Okay, but what we're doing right now, a lot of my colleagues who are strong advocates of CPR, they are teaching in public.
Nice.
Okay, so for sporting events, right? So major sporting events, usually there's not much problem. They will contact the Ministry of Health and then they will ask a team to come that. But a medical team always becomes like an afterthought, like a checklist for them to say, okay, we've organized a medical team. But without really planning, like where should they place the medical team? Because normally when the medical team comes and we'll say, where do we go? And they'll put us somewhere at the back, right? Okay, so the planning is important.
Yes, Doctor. Doctor, I'm sorry to interrupt.
Yes, no, okay.
When I grew up, we used to organize a inter-class football tournament. Even that time, we had this culture of peti emergency dah ada tak? Itu je. You're right. It's a checklist. It shouldn't be that way because when something happens, that's when the truth will be out.
Yeah.
You know, they are not ready, they are not expert. Carry on.
Yeah, so an emergency response plan should be in place. So it should in part, if you're planning and organizing, say, a running event or whatnot, so include the medical team that you have hired as part of, involve them in the planning, okay? So they can tell you where is the best place to strategize, give them access, a route for the ambulance to go in and out, okay? And make sure that, say if it's like a 42-kilometer stretch, then they have this, an AED can reach a person at any point of that 42 kilometers. So they have to plan this like within like maybe less than 5 minutes or something like that, okay? Because fortunately, because we've had a couple of cardiac arrests occurring in marathon runners. I think last year there was one, and then the year before there was one. But fortunately, a lot of doctors like to do runs as well, so they can and they happen to pass by and were able to do the chest compression. So the emergency response plan should be at the organization stage, and then the individual team as well. So if you imagine, like, say a group of footballers, one of them knows CPR, and one of them can recognize that their friend, if they see it happen, has gone into cardiac arrest, then that reduces the time of that friend getting the treatment, right? So it should be at the organization level, at the team level, okay? So, and then the general public, So places like St. John, they do free CPR and AED training. If you gather enough people, they can come to you. So they do training. There are other companies as well now. If you just Google, there's a lot of other companies as well which offers training like within the workplace and whatnot, because now they recognize how important it is to able to do CPR. So one thing I can comment about the badminton, that unfortunate event, was when you read the comments, a lot of people said that, the medical team was late. But what I came to understand afterwards is, like, when there's a competition going on, the umpire, am I right? The umpire is the one who can decide anyone who can come in, right? So that is a sign of not recognizing that this is a cardiac arrest. So if the umpire also was trained, so what I'm trying to say, like, if the people who are part of the,
it goes back to what you said earlier.
So if they can recognize and if they see that, this is a sign, because it looked like he was moving, right? But that is actually a sign of cardiac arrest. So if they had recognized that is a cardiac arrest, he would have said, stop, bring the medical team immediately. Okay? So
that was good, doctor, because this is what we want to know, bottom line of it. Because you spoke to several health experts as well. And there was one doctor who is viral on social media, doctor. It's an Indian doctor. She said, she
said about CPR.
Go all out. Go all out.
Go all out,
Now, Dr. Aisha has shared her view on this. What do you think, your point of view?
I think just regarding that Indian doctor, I think she mentioned something along the lines, if one were to proceed and do CPR, just do it as soon as possible.
Yes.
And do not worry about anything, because you would not be somewhat kena saman ke apa ke. So macam, because if you ask me pun, I didn't know about that info before she posted it online. Because if it was me, I pun akan macam, I'm worried that I might injure this person, right? If I push too much, will I break any bones, etc. So is it true that we're not, if someone were to give CPR to anyone else, we would not get saman ke apa ke?
Okay, I tak berani nak comment on that, but what my understanding, there is this thing called the Good Samaritan law. Okay, so if but it is better for if a person knows how to do it, that does it. Okay, so that's why we try to encourage as many people to be able to do it. Actually, a lot of the time that what hinders people doing, number one is because then they don't know how to do it, and they worry of the legal issues if any complications arise from
it. That might happen. What might happen?
Especially now, everyone record instead of going to help, they just record first and see what happens before going, right? So if you are trained, at least that is an additional thing. You say that I have done this training, I know how to do it. That is definitely a cardiac arrest. I am going to try and save this patient's life. Yeah. So yeah, my advice is get yourself trained so then you know what to do. Yeah. And then that risk of any legal complication would be less, because you can actually justify yourself. I'm acting out of the good faith as a good Samaritan. I have been trained to do this. I recognize this is a cardiac arrest. I am going to do something about it. Yeah.
That's the point. I mean, kita dah kesentuhkan masa dah, Dr. Aisyah. Tapi soalan terakhir saya, how can we work together to make sports industry, this whole sports activity, safer for everyone in the future? You have already pointed out 2 points that I realized. Make sure you involve the health guys, those who are handling CPR and everything as one of the main guys in the planning process. That is number one. You also mentioned earlier about pushing too much and how to get access. But overall, what would you say, Dr. Aisha?
So if I may, I would like to include, is it okay for us to do sports during the night?
Yeah. That is also
I've not known.
So there's no difference.
I've not heard of any. It's just like one of those things where you say jangan mandi waktu malam kind of thing. But there's no evidence regarding that. At night, maybe there is some relations to the your normal circadian rhythm about when your body releases the cortisol, which is a stress hormone. There is possible some relation to that, but I tak berani nak kasih advice regarding that.
So, how, Doctor? Macam mana kita nak menjadikan aktiviti sports ni safe for everyone?
Safe for everyone. Okay, so I suppose number one is what we're doing right now, so awareness. So everyone should be aware that this can happen. Even if you're healthy, even if you have been received the clean bill of health, there is a risk for development of sudden cardiac arrest, okay? Especially the older you get, especially if you're male, unfortunately, okay? So that's number one. So if you are aware, then you'll be inclined to think about it and stop and think, am I healthy enough to do this? So the next one is everyone should get themselves checked up, even if it's just a normal screening, okay, not related to that's what athletes would go through, but just in general, just basically know yourself. Am I ready to take on this physical activity? Okay. And the third one is give yourself time to gain the strength and endurance to participate in any activity. Okay. Then number 3 would be, so we've got to talk about screening, and lastly it would be my advocacy is still on the early CPR and the early defibrillation.
We have to do, I think, one more podcast session only on CPR. I think, honestly speaking, I think it's somebody, lawmakers or those who are there and they want to, got to make this mandatory, this CPR education or training part of the curriculum. Because masa saya besar, I belajar menerusi Persatuan Bola Sabit itu saja.
You just seeing them.
Not you're practicing.
In school kan kita ada PBSN, and then most thing we do was first aid, first aid, like how to balut a wound or
this
things
is critical,
like that.
Doctor, based on
so
whatever you
from
said.
now with more evidence that you can increase the chance of survival by 3-4 for this one. So why don't we train our young ones early to be able to recognize and do this? And for public now, we advocate hands-only CPR. A lot of people are afraid actually to give the breath, rescue breath. Before they used to say, you see in the films and they go and give rescue breath and things like that.
Well, in the films, the heroes.
In the films, of course. But in real life, would you dare to go and put your lips on someone you don't know? The things that. So now to reduce the delay of someone doing chest compression or the fear of initiating that, then we advocate hands-only chest compression. So just try to mimic the action of the heart as long as possible until the advanced healthcare arrives.
Next time doktor bawa barang-barang semua kita buat depan podcast. Okay guys, kita dah sampai penghujung dah, and to those who wants to know more about this, please visit www.sinardeli.my. There's a letter, there's an opinion piece from Dr. Aisha. Read up, guys. And thank you, Dr. Aisha.
Thank you very much for inviting.
We will have another session only on CPR. Okay. Dan terima kasih guys for watching it. See you next time. My name is Ashwin. Thank you.